Full mouth reconstruction is one of the more complicated things that we do in dentistry. What makes it complicated is there's so many forms of dental disease that can require full mouth construction. But typically it consists of an evaluation first to figure out the exact nature of the disease process. The most important thing is to figure out what's caused it so we can tackle that going forward. But typically it starts off with us figuring out where the teeth should be. We need to know where the teeth line up with the TMJ. We need to know where the teeth look good in your smile. For example, if we need to rebuild your teeth, if we make them 2 inches too big, your jaw is going to be like down to here. Okay, we can't have that. We need it to be where when you bite and chew, your jaw is opening and closing the right amount. You know, obviously we don't want to build them out here and give you a full mouth reconstruction that looks like Mr. Ed. So it starts off figuring out where your teeth need to be. Once we have models of your mouth, we can actually build a representation of your teeth in wax of what we think is the most beautiful way of restoring your teeth and the most healthy and harmonic way with your TMJ and with your gums. Once we have figured that out through a wax up, then we actually transfer that wax up onto your teeth. So we would put temporary teeth in place. Typically to rebuild teeth in a full mouth reconstruction, we're looking at crowning the worn or broken down teeth and replacing the missing teeth, typically with dental implants whenever we can, sometimes with a bridge, which is crowns holding up other crowns. Sometimes we will rebuild them with even like removable prostheses. It depends on your exact situation. But when we do full mouth reconstruction, once we place a temporary prosthesis in there to make sure that you're comfortable with it, we want to know that it feels good and looks good. So typically, it's at one appointment we will reshape your teeth and place a temporary set of teeth in place, which does not come on and off. It stays in as long as we need it to. And then we use a mold or a scan of the beautiful temporary teeth to fabricate the permanent restorations. So it usually takes a records appointment, a procedural appointment that sometimes we do under sedation, and then another appointment where you show us how much you love your teeth while they're in the temporary phase, and then a last appointment where we place the final restorations, which are typically ceramic crowns on top of teeth and on top of implants. The most important part after that's all done is to make sure if you've had a full mouth reconstruction, we're always going to want you to wear a night guard. So we'll have you in a night guard going forward and then follow up every 6 months. We can make sure everything stays healthy down the road. If you need any adjustments, it's very easy to do. Typically adjustments are minimal. So if you want to know more about what is involved in a full mouth reconstruction, I think a consultation could be the only way you're going to know that. So if we started with a consultation, we could kind of put your mind at ease to see if you're comfortable with all the steps involved and if you're a good candidate for it. Just let us know and give us a call.